Today we are excited to celebrate Maternal Mental Health Day. My name is Dr. Teresa Wagner. I'm the clinical executive at Safer Care Texas, and I will host today's panel discussion on maternal mental health. Today I have with me the physicians of HSC Obstetrics and Gynecology, Dr. Melanie Lagamikos, Dr. Allison Pashuko, and Dr. Hollis Bartels. Also, there's Dr. Megan Nelson joining us, who practices in the Osteopathic Manipulative Medicine at HSC Clinical Practice Group. Dr. Nelson is the only physician in the country with dual board certification in obstetrics and gynecology and neuromusculoskeletal medicine. The goal of our conversation is to discuss maternal mental health, especially during COVID-19. We know a lot of moms to be and new moms are going through a lot during these times, and we want to give advice on how to stay mentally and physically healthy. First, I'd like to define maternal mental health and discuss the potential impact on pregnant women. Worldwide, about 10% of pregnant women and 13% of women who have just given birth experience a mental health disorder, primarily depression. In developing countries, this rate is even higher. Perinatal or maternal mental health refers to a woman's mental health during pregnancy and the postpartum period, or after they've had the baby. But what causes problems regarding mental health for women? Dr. Lagamikos, who is at risk for these disorders?
Really, all women are at risk. More high-risk patients, however, are women who have had a prior history of postpartum depression or an anxiety disorder, as well as women who have a prior history of mental health disease, such as bipolar disorder or post-traumatic stress disorder. It turns out that up to 1 in 5 women actually have mental health issues in pregnancy and postpartum period. Up to 2/3 develop these symptoms even prior to giving birth. So it's much more common than we know. Also, women who have a prior history of substance abuse issues or even medical conditions like hypothyroidism can be more predisposed to mental health disorders. Some women that have had a prior history of a stressful life event or a traumatic birth can be more predisposed to these issues. Especially women who don't have a good social support system can be more likely to develop these symptoms.
Yeah, we know that those are all parts of health and well-being. So when any of those is not foundational, it would put women at higher risk surrounding pregnancy and childbirth. Dr. Pashuko, why is it difficult to recognize or admit for a woman experiencing perinatal depression or anxiety?
Some level of the feelings that a woman's going through in the immediate postpartum period, some transient sadness, obviously anxiety with a new baby at home, are to be expected. Some changes in sleep habits, appetite, and libido can certainly be normal changes in the postpartum period. So the onus is really on us as physicians to encourage patients to be aware of that and to know when that line has been crossed and that's become too severe. Another component of it is that studies, have shown that women are very unlikely to bring up these feelings on their own, thus, again, emphasizing the importance of our job in screening these women, because like kind of mental health generally, perinatal mental health has kind of historically been a little bit of a culturally taboo topic. Women might feel guilt or shame at what they're actually feeling when society kind of generally points to this as a joyous time in their life, a joyous occasion. And there's also been some limited, though thankfully growing and certainly growing with this discussion, hopefully, open dialogue about the issue, which allows both physicians and the patients to be more aware of it and hopefully more open to discussing it so that we can focus on appropriate management moving forward.
Yeah, my recent study on maternal mortality, that was actually one of my findings, and it was especially with Hispanic women were not as open to talking about it and felt some shame around it. So I appreciate you bringing out that point. Dr. Bartels, how can a woman prevent feeling depression or anxiety?
So it's really, difficult to know exactly who's going to be affected by postpartum depression and anxiety. So I think a lot of it is us being proactive as providers in our prenatal appointments, kind of like my colleagues have mentioned, to shed light on how common this really is and how many women go through this after they do deliver, and start that discussion early on in their pregnancy so that they are aware that that isn't something that they may come in contact with after they deliver, and they're aware, that there are people to talk to, that there are resources, and that we are available to help them through something that is actually much, much more common than a lot of people realize. So I think kind of just educating people earlier on rather than just waiting till the postpartum period. And kind of with those discussions and dialogues with patients, I think also encouraging patients to think ahead, if they do start to have these feelings and things either in their pregnancy or postpartum, kind of identifying people in their lives who can be support persons for them, whether it's their spouses, family, friends, kind of identifying who those people are that they can reach out to in addition to their healthcare providers to help them get through, those times and, deal with.
Right. And unfortunately, for women who don't have prenatal care or don't have good access to health care, it becomes even more of a compounded issue because they don't get that coaching prior to having the baby, especially if, it's a young mother, a teen mother. So it's hard to have that preventive aspect. Dr. Bartels, what if a woman is not experiencing depression? Are there other perinatal mental health reactions or disorders that we should know about?
Sure. So a lot of women deal more with the anxiety component than just depression. So some women, after they deliver, just notice that they have constant worry, stress over every little detail about the baby, feel like they can hardly, ever have the baby out of their sight, and just have overwhelming anxiety and worry that they struggle with, rather than necessarily classic depression symptoms. And then rarely, but it is something that we do occasionally see. There's actually things like postpartum psychosis, so pretty extreme disorders that can present in the postpartum period that can be triggered by these stressful transition in a woman's life. So that is something that is also occasionally seen.
Yeah. Dr. Nelson, are there any adverse effects of maternal mental health disorders after birth on the mother or the infant?
So certainly, this is, a deviation from the normal, so it's obviously going to take a toll. So mental health disorders place added stress on the body and can compromise that mom's ability to heal and feel well. And then it's also known that even outside of the peripartum period, that mental health disorders can alter a person's ability to tolerate pain. And unfortunately, pain is a normal part of the birthing and the postpartum process, especially in the setting of an operative delivery, if mom had to have an episiotomy or had to have a C-section. So a mom dealing with peripartum mental health issues is likely to be experiencing more physical as well as the emotional pain as she cares for her infant, which, being a new mom and taking care of a tiny baby for 24 hours a day is very taxing, both physically as well as mentally, emotionally. This is a time of little sleep, a lot of exhaustion, fussy crying baby that mom is trying to get to know. She doesn't know that baby's cues yet. She's carrying the baby everywhere. She's bending over at the waist to change minimum of 12 diapers a day. So all of that is really taxing on her body. And then the mental health issues can impact that mom's ability to feel bonded with this baby that is new to her and establish a strong breastfeeding relationship if that's something she's working towards, because the hormonal release required for both of these things, the oxytocin that comes from our brain, that's nature's kind of feel-good, warm and fuzzy hormone, but that is known to be inhibited with mental health disorders. When your brain chemistry is altered, that hormonal cascade that's required for both bonding and breastfeeding is altered. So very quickly, this can become a vicious circle where mom doesn't feel good about herself physically and mentally. Then she struggles to bond with her baby. She struggles to care for the baby, produce enough milk for the baby, or reach her nursing goals, and then feels worse about herself as a mother again. And then it can spiral out of control.
Right. Yeah. As you were talking about how exhausting that is, I was remembering my children's babyhood. It definitely is challenging. Dr. Pashuko, what should a woman do if she is experiencing mental health issues?
The main thing she should do is ask for help. So whether that's to her obstetrician or oftentimes a pediatrician, because sometimes moms are going to the pediatric office more frequently than they are coming to see us with their newborns. That is another great resource and certainly one of our allies for reaching out. The patient's own family, friends, or local support system. The most important part is certainly having a conversation with someone and then hopefully being able to be directed to the right people from that. There's also a great resource from Safer Care Texas that includes the What About Mom app that allows women who are having some issues postpartum, not just related to mental health, also physical conditions, to kind of understand a little bit more about those conditions and thus be able to determine whether or not what they're feeling might be part of a normal change that their body's going through or something that requires a little bit more evaluation and intervention from medical professionals. These apps, the information on the internet, as well as your providers are all people who can hear how you're feeling and work with you to come up with the best plan moving forward.
Yeah, actually that app was developed by me. It was part of my research project that I was talking about on maternal mortality. And when we were developing the app, we had originally just had the physical aspects that they could look up, the hemorrhaging and potential stroke, things like that. But as we talked with the moms in the research and found out that they actually were having these mental health issues, and many of them, we were the first ones that they talked to about them, and found out that what they did need was partner support and someone to talk to that they felt safe talking to. And so we added the other two buttons to the app, which included mental health or postpartum depression, and then also partner support, so that the partners could actually use the app and see, oh, these are the things I should be doing. I should be helping around the house. I should be helping with the baby. I should be going to the grocery store or monitoring her for physical symptoms and bringing them to her attention or at the next physician's visit. Thank you. So Dr. Nelson, is it possible for non-specialized health providers to identify and manage maternal mental health disorder?
So absolutely, just to echo what Dr. Pashuko said, I think any member of the interprofessional team that's caring for mom and baby in the peripartum period can express concern and either initiate management if they're skilled in doing so, or get mom plugged into those who can begin treatment properly. Personally, I work really closely with pediatricians as well as lactation consultants and partners and spouses to establish a tightly woven web of support for mom. So even though mom might be, like Dr. Pashuko said, at an appointment for the baby, or she's seeing the lactation consultant to address nursing issues, all of these providers are also checking in on mom. A lot of pediatricians go so far as to administer a postpartum depression screen to mom at one of the newborn visits, and then they coordinate with mom's care team. So whether it's obstetricians or someone like myself who's doing OMT for mom and the babies, this way we know that mom is being properly treated, scheduled for follow-up. And if we can break the stigma and educate the public, those family members, friends, people who are calling on mom and baby at the house about maternal mental health, more people now can be on the lookout for symptoms and bring it up to mom. She might not even know that this is not normal. If she's a first-time mom, she probably thinks this is how she's supposed to feel. But those other people who are supporting her and kind of looking from the outside in can bring these symptoms up to her and help her know when to ask for help and get the help that they want for their loved one.
Yeah, and feel comfortable asking for help. And I love that you have that kind of interprofessional team working together, but it not only includes health professionals, it actually includes people from their family and, just everyone that is around the mom together. So that's a great way to handle that. Dr. Lagamikos, how long would it take for someone to recover from a maternal mental health issue?
So, I mean, that's hard to say because there's no definite time frame because every patient's really different. So it's more of a case-by-case basis. But what's important to remember that it can extend beyond a year, just depending on when the patient was really evaluated in the first place, and also when it was diagnosed and when treatment was initiated. So it really just depends on evaluating and reevaluating these patients on a monthly basis, checking in with them, screening them, and social support plays a key factor in this as well and can help speed up that recovery process. The important thing to remember is that none of this is clear cut, and so I want patients to know that there are treatment options and resources like the app that we have available for them, and that women can recover from this. It's just we are here to provide them with the adequate support to do so.
Yeah, and I would think it would be really dependent on the types of resources that they have available to them. So women in underserved areas might have more of a struggle recovering. So now let's talk a little bit about how COVID-19 has affected pregnancy and delivery in general. Dr. Lagumikos, first, has COVID-19 affected regular in-office antenatal, which is normal pregnancy-related visits?
It definitely has. In our practice, we've reduced the number of in-office visits to avoid exposure. We've introduced and incorporated more telehealth visits, especially for our low-risk pregnant patients. In addition, we've combined visits to reduce those in-person exposures and allow for that interaction to be through telehealth a little bit more. And for patients to be more vigilant for at-home monitoring as well. We've asked them to purchase, blood pressure cuffs, and some patients have purchased Dopplers, fetal heart rate Dopplers, to help monitor baby at home. What else is changing? Patients are now coming to their visits alone, so that changes the dynamic a little bit in the office because, we're used to having patients and their families come in for sonograms and things like that. And right now we're not really allowing any other family members in the office to help reduce that exposure risk. And then we are also just spacing out the visits to help, minimize those risks. So I know it's changed a lot, but we are, grateful that our patients are working with us and we're still providing the care that they need.
Yeah, I think it's great that they can still get the care, but at the same time, I think that would be very difficult to have to leave your loved ones at home and come in by yourself for a visit, or deliver alone for that matter. Yeah. So yeah, I'm sure that that's going to play a role for mental health issues, at least in this period of time. Mm-hmm. Dr. Pashuko, has there been any changes to labor and delivery protocols, and what should a new mom expect for delivery during this social distancing time?
Yeah, I think to echo what you were just understanding from what Dr. Lagumikos was saying, the main change, and certainly the one that's grabbed the most media attention lately, has been that change related to the visitor policy. So most places around the country, honestly, at this point, are limiting to only one support person. And again, this is all just a attempt to try to limit exposure to patients, their partners, as well as obviously the hospital staff. So currently that's what we're working with. There's one support person that's allowed to be present for the labor and delivery process. That same person should be the one that's staying throughout then the whole stay. So related to that is similarly, hospitals are kind of routinely closing their doors to any visitors at this point. So having grandma and grandpa come postpartum to see baby in the hospital is not something that's allowed right now. And that's, again, to protect everyone involved. And then another change that patients will see when they're on labor and delivery and within the hospital is that at this point, all staff, all patients, and all of those partners are supposed to be wearing masks. And then the third main change that might be noticed is this is not something that's been able to be executed at every place, but certainly I think a goal across the country is to be able to actually test every labor and delivery admission for coronavirus infection with a PCR sample because of concern for asymptomatic carriers. So that's not something that's available everywhere just yet, but that is ultimately a change that patients might expect down the line. And in terms of what moms should expect for delivery, besides those kind of more obvious outside changes that they'll see, they should also remember that they should expect that even though this is a different experience than what they'd probably built up in their head, it's still absolutely one that's focused on having a happy and healthy mom and a happy and healthy baby. All the staff there is aware and sympathetic to the anxiety of these times and these changes, and actively working to provide all the necessary support, some extra support when needed, to continue to allow this to be a joyous occasion for these families.
Yeah, that would be difficult, and it's great that the staff is working to make that a little less stressful. Dr. Bartels, how could COVID-19 infections impact pregnancy? And most specifically, are there any potential impacts for the fetus or what we would call the unborn baby?
Yeah, so, one of the big things to keep in mind is that this is a new virus, so there's so much unknown and very limited data at this point in terms of just the effects on pregnancy and baby. But that being said, from what we do know so far, the very limited information that we do have is at this point, it doesn't look like pregnant women are having any worse outcomes than non-pregnant women at this point. So, but again, just much more data and information needs to be collected as time progresses. That being said, we're being trying to treat pregnant patients with extra caution. We do know that like SARS and MERS, similar viruses to the coronavirus in the past, were linked with more adverse or poorer outcomes in pregnant patients. And so just still treating pregnant women was an abundance of caution, but so far they've done pretty well. And another concern is pregnant patients that already have underlying medical conditions are potentially even at higher risk. So just keeping, it's kind of an ongoing, changing all the time and learning more information as we go. In terms of baby, at this point, there's been no confirmed evidence of what we call vertical transmission, or an infected mom passing the infection to the unborn baby. Again, still that's something that's being continually looked at, but as of now, it doesn't look like that is the case. So
that's good to know. Dr. Nelson, what should soon-to-be moms do during this time to keep mentally and physically healthy?
Well, I think even outside of a pandemic, it's important for all expectant and new moms to try to minimize risks whenever possible. So as far as COVID goes, it's pretty obvious now. It's been, well distributed across the news and whatnot. Continue to practice social distancing, wear your mask, maintain proper hand hygiene. I encourage my patients as well as my loved ones and our family. We use online grocery ordering so that you can do your store pickup rather than entering that crowded public place. But if that's not an option in your neighborhood, send another member of your family to go fetch what you need from the grocery store. Try to maintain normalcy as best as you can in terms of getting outside every day. Get that daily dose of vitamin D. Get some movement, right? Working out will help you release endorphins for a natural high, and improving mom's fitness and endurance during pregnancy to get ready for labor, ease some of the aches and pains that grow with all the changes that are happening in her body to accomplish pregnancy. Continue proper nutrition as best as you can, taking those prenatal vitamins, trying to get 7 hours of sleep a night. And, I think in these trying times, this unprecedented time, it's especially important to limit or filter one's intake from digital sources. So whether it's television, the internet, everything that we have available on our phones, a moderate amount of news in order to stay informed, and news from reputable, right, trustworthy resources is fine so that you're informed, but dwelling on every detail across the country or obsessing on things outside of our control is an exercise in futility. And really, this is something that's an important lesson for parenthood, for all moms, that we can plan all we want, whether it's your birth plan or for your baby's childhood, but we actually don't have a lot of control. That's a lesson that I'm still struggling woman with 2 children now, but when it comes to labor and delivery, and as our children, as they're growing up and making their own decisions, we can plan and prepare as much as we want, but we don't actually have as much control as we'd like. So limit your social media to something that's uplifting, empowering, positive messages, educational ones like you find on the app, something with strong science behind it rather than blogs or chat rooms. And when in doubt, ask your OBGYN. We'll direct you to the proper sources of educational and supportive materials for you and for all of your questions.
That's great. Yeah, definitely credible source and asking your doctor for sure. My kids are 28 and 24, and I still don't have control, so I could definitely relate. Dr. Lagamikos, to close out, do you have any indication as to when delivery and regular pregnancy-related visits will go back to normal?
So unfortunately, as of right now, we don't really have a good indication of when things will return back to normal. I think, updates are happening every day, and this is kind of a fluid process right now. However, we are expecting to resume a new normal eventually. And I think what that means is, we'll still be able to practice social distancing in the most safe, in the safest and most effective way, and where we can still care for our patients. I just want, our moms to know that just because the world is really scary right now, it doesn't mean that their pregnancy or their labor has to be. Some of the feedback I've gotten from pregnant patients that have recently delivered is that they've actually enjoyed the one-on-one time that they've had with their baby. Even though they're missing their families, it's a time where they can do more skin to skin and be alone and really bond with their baby. So there is a positive to this as well. And I really, just like Dr. Prosciutto said, our focus is, a happy mom, healthy baby, healthy mom. So, we really want to focus on that, make sure patients still seek access to care.
Great. Yeah. Well, thank you so much for joining me today for Maternal Mental Health Day. We hope this discussion has helped everyone learn more about maternal mental health and what to do if you're feeling anxious, depressed, or just having any fears around the COVID-19 epidemic and during or after your pregnancy, and reach out. For more information, they can visit our website at unthsc.edu/patient care or call HSC Obstetrics and Gynecology at 682-207-1375 or Dr. Nelson in the HSC Clinical Practice Group at 817-735-2235.